Hi, I'm Dr. Tom Farley from Healthscaping. Today I want to talk about the use of cannabis and the risk of psychosis. Now, psychosis is a condition in which people lose touch with reality. They hear things and see things that aren't real. Those perceptions are often mixed with paranoia, that is to say, a feeling that others are trying to get them. Psychosis is a key part of a disease called schizophrenia, which is, of course, a serious mental illness. People who have schizophrenia usually have their first episode of psychosis when they're teenagers or in their young adult years. Now, there's a group of researchers working in 6 countries that have been keeping track of people having a first episode of psychosis. And they've been identifying risk factors, that is to say, exposures that put people at higher risk. And they found that smoking cannabis is a risk factor, but one that depends on how often people smoke and the THC content of the product that they're smoking. Now, THC, of course, is the active chemical in cannabis. That's what gets you high. Compared to people who don't smoke at all, the risk of having a first episode of psychosis is about twice as high in people who smoke daily and use a product with a THC content below 10%. But it's nearly 5 times as high in people who smoke daily and use cannabis with a THC content above 10%. What's the significance of that 10%? Well, the potency of marijuana that is sold by pot dealers has skyrocketed in the past few decades. In the 1970s, marijuana was typically 1 to 4% THC. By the 20-teens, a typical product was maybe closer to 12% THC. Today, the products are shockingly potent. I checked out a few retailer websites. There seems to be an arms race amongst retailers about who can sell the most potent cannabis, as if somehow a more potent product is better. Most dry products that are sold now are between 20 and 30% THC. Now, most pre-rolled joints that they sell are about 350 milligrams. If you smoke entirely one of those, you're going to absorb between 70 and 105 milligrams of THC. That's about 7 to 10 times the dose you need to get high, and it's enough to make you very paranoid. What about edibles? Well, edibles may actually be worse, because people can eat many edibles and consume an awful lot of THC before they have any sense of getting high. All of this is an argument that if we don't want to have an epidemic of psychosis, the states that have legalized marijuana need to set potency limits for the cannabis that's sold. I discuss this and more in my newsletter, Cannabis is Driving People Crazy. Check it out at healthscaping.substack.com.